Hi, my name is Alice, and this is my PowerPoint presentation on Disaster Recovery Plan. Introduction. A disaster is a sudden occurrence that interrupts daily life in a society and leaves a wake of devastation in its wake. Natural disasters like floods and chemical explosions may occur as man-made disasters like earthquakes and tsunamis. It is critical to identify and implement a disaster plan to minimize losses. In the aftermath of a natural catastrophe, if there are enough medical personnel, equipment, and support in transporting those affected, lives may be saved. Villa Health Community. The Villa Health community was devastated by a natural disaster that left them in a shock and in need of rehabilitation. After speaking with the medical facility and local officials, it is evident that their disastrous rehabilitation strategy had to be revised. In an emergency, the government's Federal Emergency Management Agency, also known as FEMA, responds accordingly to the Department of the Interior. Preparation, participation in, and recovery from a traumatic experience are all considered part of the rehabilitation process. The ideal disaster recovery strategy should result in resolutions rather than new problems. MAPIT systems and objectives. M equals mobile. The objective is to mobilize collaborative partners. A equals access. The objective is to assess community needs. P is for planning. The goal is to reduce health inequities while boosting community access to services. I means to implement. The objective is to have a plan that will help manage the healthy people of 2020. And lastly, T is for track. The objective is to have the community process tracked. Steps of MAPIT interventions. The first step in the procedure is finding and bringing together a team of coworkers. Medical clinic employees should remember to communicate with each other in the event of an emergency and whether clinics are looking for new patients. An investigation and salvage team should also be formed, assuming they would be relocated to the local region after the looming danger has passed. Steps of MAPIT interventions continue. MAPIT is the second phase to assess. During this cycle, the following questions are asked. Who will be affected? What resources are needed to achieve the goals? Is there a sufficient supply of resources to accomplish the goals? The population of Villa Health is a diverse one, necessitating the use of specialized resources and requirements. Many elderly people reside in nursing homes or assisted living facilities when they have no other places to go. Appropriate stakeholders should be considered local area pioneers in the current situation. Factors affecting community recovery: social factors, health factors, financial factors, and cultural factors. The MAPIT system organizing process. An episode war room's execution and planning are essential in this case. War room should be staffed with disaster recovery experts and people from the local region, such as 911 administrators, medical caregivers, and others. Clinics should be prepared by having personnel on hand and ready to go. Examples of disaster recovery policies are health policies and government policies. Recovery process. To accommodate everyone appropriately and in an organized manner, search and salvage teams should be separated into groups and given designated spaces to do their work. When an area has been thoroughly examined, a notice to the war room is essential to avoid duplicate efforts. It is necessary to provide mappable areas for progress on repairs. And in conclusion, the disaster recovery plan must use the MAPIT system to coordinate effectively. This framework includes methods for enlisting allies, determining the local community's needs, devising a plan to reach the desired locations, and monitoring the plan's success. Villa Health's people group and pioneers can work together to further expand recuperation locations by establishing a strong relationship. A sustainable recovery strategy utilizes government assets while considering the needs of the local region, disparities in health, and communication difficulties. Everyone will benefit from a well-planned and well-executed event. References. Again, my name is Alice Hill. I hope you have enjoyed my presentation on the disaster recovery plan. Thank you for listening.